Good morning, everyone. Thank you for joining us for another COVID-19 media update here at CDPHE. We've got a couple of presenters on deck for you here this morning. Note here, a couple of housekeeping items. We do have a couple of interpretation channels available. We have a Spanish language interpretation channel, as well as an American Sign Language interpretation option that you can toggle there at the bottom of your screen. And do note too, the gray slider bar in the middle of your screen, you can use that to customize your view for whatever captures you're looking to get, and you can basically slide that and adjust the size of the deck and the presenters. So today we have Dr. Rachel Herlihy, our state epidemiologist, and Director Scott Bookman, a COVID-19 incident commander at CDPHE. And to get things started, we'll send it over to Dr. Herlihy.
All right, thank you, Brian. Good morning, everyone, and thank you for being here. So starting here where we usually do, taking a look at case trends here in Colorado. So each of those gray vertical bars shows you daily cases in the state, and then that red line is showing us our 7-day moving average trend. So taking a closer look at that 7-day moving average trend, you can see that unfortunately we are seeing a pretty clear increase in cases. What looked like a plateau over the last couple of weeks, unfortunately, is looking a little bit more and more like a steady increase in cases here in the state. Our 7-day average value yesterday was unfortunately the highest that we've seen since mid-January. So again, an unfortunate trend that we're seeing in cases here in the state, especially while we're seeing cases in many parts of the country going down at this point. So hoping to see those numbers stabilize very soon. Next slide. Taking a closer look at trends by age group. We do continue to see our highest rates of cases among our school-aged children. Here I'm showing you trends in 5 to 17-year-olds. So those are primarily our school-aged kids compared to adults and then younger children. So again, you see the highest rates are among those 5 to 17-year-olds, followed by the adults. And then the lowest rates and the most stable rates seem to be occurring among our 0 to 4-year-old population. So that continued high level of cases among the 5 to 17-year-old population is a continued reminder of the importance of vaccination in that population. So for those that are 12 to 17, many of those cases are preventable. And so certainly want to see that population that is 12 to 17 and eligible for vaccine right now get vaccinated. For those kids that are younger, so in that 5 to 11-year age group, which includes my daughter, we're looking forward to vaccine becoming available very soon for those younger children, expecting that to happen sometime in early November. Next slide, please. I want to talk a little bit about Halloween guidance and how to make your Halloween safer, whether that is holiday celebrations, Halloween celebrations for adults or for children. There's lots of things that we can do. It's many of the same things that we've been doing throughout the pandemic to make gatherings safer. So most important is, of course, to stay home and unfortunately avoid some of those events if you are showing any symptoms of COVID-19. We don't want to spread cases from person to person, and we know that a way that those cases can spread rapidly is through larger gatherings. So please, if you're showing symptoms, please stay home this holiday season. We know that masks are also an important strategy for reducing the risk of transmission at gatherings. Unfortunately, costume masks, while they might be fun and festive, are probably not a great substitution for a real mask that we know there's evidence for preventing transmission with those real masks, whether those are cloth or surgical type masks. So keep in mind if your costume has a mask as part of it, that you will need another mask to protect yourself and others around you. If it's difficult to breathe with having a mask over your costume mask, consider using a themed mask instead as a fun and festive way to protect others, but protect yourself at the same time and still be festive and in the spirit. We encourage you to gather with family members and close friends that you know have been vaccinated. Again, that's another strategy to decrease the risk of gatherings. And if all adults and kids over the age of 12 that are attending those events are vaccinated, that does mean that the risk to younger children that are attending the event is also much lower. We know that outdoor gatherings are consistently lower risk events than indoor gatherings. So whenever possible, encourage you to gather this Halloween weekend outdoors. And we also know that smaller gatherings are safer than larger gatherings. So encourage you to keep it smaller, keep it outdoors, keep it to folks that you know are vaccinated. use masks, and certainly stay home if you're feeling ill. Next slide. So back to some of the data. So unfortunately, we do continue to see an increase in our percent positivity value. So this is the percentage of our PCR tests that are coming back positive on a daily basis. So we have seen a pretty significant increase in that value in just the last week. So last week, that number was closer to 7%, a little below 7%. Unfortunately, in the last week, we have seen a surge in that percent positivity value, now up around 8.5%. We know that this can be a leading indicator, meaning that it could be an indicator that our cases could be increasing as well in the next week, which again could result in hospitalizations trailing behind by another week or so. So unfortunately, seeing this increase, which does suggest to me that we could see an increase in cases next week. Next slide, please. With that, I'll hand it over to Director Bookman.
Thank you, Dr. Herlihy, and thank you to everybody for joining today. Again, to present on our hospital data, we are continuing to move very much in the wrong direction this week. And again, today, we are now at 1,187 COVID-19 hospitalizations. While we are still below that high on December 1st of 2020 of 1,847, you can see how steep the curve is at this point in time. And with the increasing percent positivity, the concern about increasing cases in the coming weeks, we're all very concerned at this point about what we are seeing in our hospitals. Next slide, please. And so, we've talked at previous press conferences about the impact of vaccinations on hospital rates. And we do know that there is a direct correlation in counties that have higher rates of vaccination, that they do see lower rates of cases, hospitalizations, and deaths. But really wanted to show everybody here today the impact that many counties are having on the overall hospitalization picture in Colorado. And across the metro area, across the I-25 corridor, we continue to see counties with high numbers of hospital admissions impacting our total hospital capacity in the state. So El Paso, Jeffco, Arapahoe, Adams, and Denver are in the top 5 here. We see many other counties right behind them. And then there are 33 other counties that bring an additional 114 hospitalizations to our hospitals across the state. And so on the next slide, showing you a graphic that we brought out last week. The blue bar graph looks at COVID cases per day and COVID hospitalizations. And then the orange line is looking at total acute care beds available. And what we continue to see is this precipitous decline in the number of hospital beds that are available in the state. Our 7-day moving average of available beds is down to 959, while our COVID hospitalizations continue to increase. And so we are seeing, certainly hospital capacity challenges in northern Colorado, but at this point we are starting to see, real tight hospital capacity in many areas of the state. And we are continuing to work with our hospital partners to ensure that we are using every bed available in the state. Next slide. So, what can we do to protect ourselves? What can we do to protect our hospital capacity? We recommend that all eligible Coloradans receive both their annual influenza vaccine and their COVID-19 vaccine. Experts recommend annual influenza vaccine for everyone 6 months and over. And we do know that it is safe to receive the COVID-19 and flu vaccine at the same time. Flu shots are widely available in the state of Colorado. You can find the flu shot by going to vaccines.gov. And if you don't have health insurance, you can find free or low-cost flu vaccine on our website, cdphe.colorado.gov. Find free vaccine provider. And a reminder, with the holidays coming up, there are some deadlines to be fully vaccinated by the holiday. And so if you want to be fully vaccinated for Thanksgiving, you need to receive your first dose of J&J by November 25th. For or November 11th, the holiday is on November 25th. For Hanukkah, which starts on November 28th, you need to receive your J&J by November 14th. And then for the Christmas holiday, we still have the ability to get both Moderna, Pfizer, or J&J, with Moderna having to have received your first dose by November 13th. Next slide, please. And so, as we look at where we are today, we are excited about the upcoming holiday weekend and to, be able to participate in such wonderful traditions in our state. But it is important that we continue to be aware that there is a lot of COVID in our community at this point, and we really need to be safe. So enjoy outdoor activities. Wear a mask, a medical grade mask, not just your costume mask. Please drive safely. We have seen increase in trauma cases impacting our hospitals. And so we really do want to urge people to celebrate this holiday safely. And if you don't feel well, stay home. It is really important that we do all that we can at this point to minimize the spread of COVID and any other illnesses that could result in people getting sick or being hospitalized. And please get vaccinated as soon as possible. This is how you protect your family, you protect your community, you protect yourselves. It allows us to prepare for future holiday gatherings in the coming months. And we are all excited about the opportunity for our 5 to 11-year-olds to receive this vaccine in the coming weeks. My son, who is 10 and a half, we are ready to get moving to get him vaccinated. And so, again, please celebrate safely this weekend. And Brian, I'll turn it back over to you.
Thank you, Dr. Herlihy and Director Bookman. We're going to go ahead and open things up to our media Q&A portion of today's availability. A couple of reminders: if you have any questions on topics that were not covered at today's media avail, or just any questions that are not able to be answered, please email us at media_info@state.co.us, and we'll get back to you as soon as possible. We'll go ahead and use the raise hand function here. It's at the bottom of your screen. You'll be able to find that, and we'll call on people in order that they raise their hand. Let's stick with first questions first. If we have time towards the end, we can circle back with some follow-ups or some second questions if time allows. And please do announce your name and outlet before asking your questions. Let's go ahead and get started with Matt Bloom. Go ahead, Matt.
Hi, thank you so much. Can you hear me?
Yep.
Great. This is Matt with CPR News. Scott, with the upcoming vaccinations of younger kiddos, that is going to put a strain on the vaccine distribution system. Are you doing anything new or different to prepare for the influx of demand, especially with more folks getting booster shots as well?
Thanks, Matt. That's a great question. We are excited that this opportunity is coming to make another part of our vulnerable population safe from COVID. And the governor will be going more in depth later this week at a press conference to talk about our 5 to 11 vaccine campaign. But, we have more than 1,000 COVID-19 vaccine providers in the state. We have the capacity to administer over 500,000 doses of vaccine. And so we feel very confident about our ability to meet the needs here. And we're also working on ways to really make vaccines for 5 to 11-year-olds a better, a good experience for them. For this younger population, it's not always the easiest thing to get vaccinated. And so we want to make sure that we are creating an environment with community partners and others who can help us create a good environment for our kids to get vaccinated.
Great. Meg Wingerter, go ahead, Meg.
Hello, this is Meg Wingeter from the Denver Post. Earlier this week, Dr. France had raised the possibility of the state reinstating some COVID rules if hospitalizations continue to go up. And there isn't any movement on the local level. Could you talk a bit about where that discussion stands and at what point the state would have to intervene?
Yeah, we are continuing to work with our hospitals and continuing to work with our local public health partners. The spread of COVID-19 across our state is not consistent. It's not uniform. And so we do still believe strongly that, local control and local orders are a key way to ensure that the right mitigation measures are put into place. And so, we will continue those conversations with our local partners over the coming days.
All right, Seth Klayman, go ahead, Seth.
Hi, Seth Klayman from the Gazette. I don't know if this is better I imagine it's probably better for you, Scott. What is the state doing as far as surge planning, as well as, helping hospitals get boosts as far as staffing goes? It sounds like that's as big of an issue as influx of patients. Thanks.
Yeah, staffing is a problem everywhere in every one of the sectors across our country at this point, and obviously is impacting our hospitals as well. And so we know that our hospitals are really good partners. They've been doing a wonderful job of moving staff from less critical areas to take care of the sickest patients, and really opening up their surge areas to meet this increase in demand. In many areas, they're starting to put two patients into a room as needed. And so in conjunction with the Colorado Hospital Association and our combined hospital transfer center, we continue to move patients from areas of higher volume to areas of lower volume to ensure that we're using every hospital bed available in the state.
John Frank, go ahead.
Yes, John Frank here at Axios. Following up on Meg's question, I'm hoping you can answer that second part of her question that you didn't get to, which is, at what point would a local order be needed? As in, how close will we get to capacity? What is that benchmark that the state would push local authorities to make some kind of public health order put in place? When would it kick in, I guess is what I'm asking.
I don't think there's a specific number that we can point out to. We are in constant communication with our hospitals, constant communication with our local public health partners and emergency managers at the local level and at the state level. And so we continue to monitor, we continue to talk to our hospitals to really understand where they are. And we are particularly working with Larimer County, which took it upon themselves to issue their indoor mask mandate, and really want to commend the leadership of Larimer County for taking that action. And we'll continue to work with our local partners across the state.
Hey, Vinny, go ahead.
Thank you. Hello, this is Vinny Del Giudice of Bloomberg News in Denver. A couple of data questions. The total acute case hospital bed availability, the 7-day moving average, 759. Is that the lowest of the pandemic or the lowest since when? Do you have data on ICUs? How many beds are available and the capacity utilization rate at ICUs? And finally, the increase in cases, it's the highest level since mid-January. What is that number? I seem to have missed it. I'm scribbling down my notes. Thank you very much.
So I think I can take a shot at the first one there, or the first two, and then I'll turn it over to Dr. Herlihy. So we are at the lowest number of hospital beds that have been available in the state at any point in the pandemic. We are now, like I said, a 7-day moving average of 959 acute care beds available. As we showed on the earlier slide, when we were at our peak of COVID hospitalizations last December, we still had 1,800 additional beds available. Today, we're below that peak, and we only have, again, an average of 959. We see about 90% occupancy in both our medical surgical beds and our ICU beds. So it's pretty uniform how many beds we have available in both of those areas. And so, right now we have about 125 ICU beds available in the state. And that fluctuates minute to minute as patients move in and out.
All right, let's move on to John Ingold. John, go ahead.
Great, thanks. Yeah, it's John Ingold from the Colorado Sun. I have a question on boosters. I've heard from people who have gotten text messages from the state telling them that it's now time for them to get their booster shot, and they don't believe they meet the eligibility criteria. And the governor's been maybe a little bit unclear on this as well. So I'm wondering, is the state's guidance here sort of winkingly telling everybody to go get a booster, or are you asking people to stay within the federal eligibility criteria?
So the federal eligibility criteria is really about people who are at high risk. And so depending on the setting that you live in, obviously, if you're in a long-term care facility, if you are over 65, if you have a high-risk medical condition that may make you, more at risk for a severe outcome of COVID. And then if you have, the work that you do would put you at risk for contracting COVID. And so that is consistent with the federal guidance. We want to make sure that all Coloradans are aware that the boosters are here and that they are eligible for it. People do need to, look and understand where they are on that continuum. But we wanted to make sure that everybody knew that the boosters were here and that eligibility, who is now eligible. There's been a lot of, I think, confusion coming out of the federal government and the national media as booster approvals worked their way through FDA and CDC. And so we really just wanted to make sure that we were notifying all Coloradans that the boosters were here and that there is broad eligibility for them.
Great. Michael Deoana, go ahead.
Yeah, Michael Deoana with KUNC News. This question for Dr. Herlihy. The prevalence of COVID hospitalizations are declining around the country as a whole. They're down about 11% in the past week, according to the CDC. What are your thoughts on why Colorado isn't following this downward trend?
So I don't have a great answer for that. And believe me, I'm looking to national sources to try and help explain this. We do know that there has been variability throughout the pandemic in certain parts of the country seeing increases while other parts of the country were seeing decreases. Some of that might have to do with seasonality. We don't know exactly, but we have seen this regional variability throughout the pandemic. If you look at the states right now that have the highest rates in the country, they tend to be states that are in the northern part of the country and some of our neighboring states. So some of the highest state rates right now include Utah, New Mexico, us, of course, Montana, the Dakotas, Idaho. So it tends to be northern states, also some states in the northern Midwest. So it's really difficult to know exactly what the reason might be. But one of the things that I also remember from last year is that Colorado started to see an increase in our cases a little bit earlier in the fall than some other states did. So we saw the nation peak more like December, January, while Colorado peaked November, December. So it does seem that there are some differences. Hard to know how much of that is weather, seasonality versus other factors that we really are still trying to try and understand with this virus.
Do we have any other first questions in the room? If so, please raise your hand. All right, well then let's go back to Meg. Go ahead, Meg.
It's been a while since we've gotten any updated projections on where the trajectory might be going. Do you have any of those estimates that you could share?
This is Rachel. So yes, we have been working closely with our modeling team to take a look at updated projections. And so we'll be taking a closer look at that and hope to have our modeling team share that data in the near future.
All right, John Frank, go ahead, John.
Yes, I wanted to follow up on the question from earlier. I'm just wondering why it's so hard to get information and why y'all are being so secretive about what these new orders may be, or what may be in them, or who may be impacted, and whether you're concerned that that's just going to cause more confusion. Thank you.
Scott, I'll try to take that one. I think, our goal has always been transparency and will continue to be transparency. Right now, we continue to evaluate hospital capacity. We continue to evaluate the trajectory of the pandemic, but most importantly, we continue to work with our local partners who have the best understanding of what is happening in their communities and the best way to mitigate spread of the disease in their communities.
All right, Matt Bloom, go ahead, Matt.
Thanks. I just wanted to follow up on John Ingold's question about the texting campaign. Can you clarify how you're determining who you're sending those texts to? And do you have federal buy-in to be doing a campaign like that?
So we simply went in and looked at people who were more than 6 months out from their Pfizer or Moderna, and more than 2 months out from their J&J, which is based on the federal guidelines, and simply wanted to make people aware that they were at the point in time where they may be eligible to receive their booster, and then really making sure they have an opportunity to understand what the criteria is, to speak to a provider if they feel that's appropriate, and then to make their decision to get the booster.
All right, thank you everybody for joining us for our media avail this morning. If you have any questions that were not answered or that we were not able to get to today, please email us at media_info@state.co.us and we'll get you some information as soon as we can. We appreciate you for joining up with us this morning. Thank you and have a good rest of your week.